We're live.
Thanks, Megan. All right, good morning, everyone. It's 8:04. I'd like to call the January 25th, 2022 meeting to order. Present, we have Norman Weinberger, Board of Health member, Ken Willeen, board member, and Terry Quell, board member. And for the staff, we have myself, Deanna Diamore, Teresa Argandesi, Aniela Fignon, Brian Weeks, Megan Fogno, and we also have Telesco present. So good morning, everyone. The first meeting on the agenda is approval of the November 23rd, and I had a typo, it's the 2021 meeting minutes. So do I have a motion for approval of the minutes?
So moved.
Norman Weinberger, do I have a second?
Second.
Gary, second. Okay. Any discussion, any edits, any comments on the minutes? All right, all in favor of approval of the November 23rd, 2021 meeting minutes, say aye.
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 Any opposed? Any abstentions? All right, it passes. Thank you. The second item on the agenda is the director's report. So I have a few updates I wanted to share. We've had some recent staff members join. We now have a WIC nutrition aide that has joined the team. So now we're fully staffed for our WIC program with 4 staff members. So that's really great. We also have 2 community health workers who have recently joined us. We've got a grant from the state health department. The focus is on COVID vaccination and outreach. And so we're really excited to have those staff members join. They're off running and doing a great job already, learning, getting oriented to the department. So we're looking forward to having them on the team. We also had a part-time physician assistant who has joined us, who's going to be helping us with our clinical services. One of the first areas of focus will be with the latent TB treatment. So we're excited to have a new member on board for that. You may recall in a past meeting, we talked about the mental health and wellness of, the community and in staff in particular right now. So we did organize a couple sessions with our employee assistance provider to have them be able to talk to our staff about what benefits are available to staff members as part of that program. They were well attended by staff, and I'm hoping that, more staff will take advantage of the services that are available to them if they're in need of them. So I just wanted to let you all know that. And they also are available to do, different, trainings or sessions as needed throughout the year. Megan is working right now she's putting together a quality improvement training for all the new staff members, because we know we've had a lot of new staff members join. So she's planning that for next month. So that's moving forward, doing a quality improvement intro and refresher. We're also, Aniela and all the supervisors and staff and Megan, they're all working on updating all our different policies and procedures. Remember, we talked about this a couple of months ago. And so they're continuing to work on that. Many of them are updated. And so we're going to be reviewing all of them and sending them off to you guys. And I'll make sure we give it at least like a good enough time for you to review it before we bring it to a board meeting. So you have time to look through it and gather your notes and feedback, but we are still planning on bringing those to a future board meeting, but we're working behind the scenes on updating them right now. We're also looking at our ICS structure given all the new staff and looking at the different roles. And so Glenn and Megan and Yella and I and other supervisors are looking at them and planning, new roles for people. And Glenn is going to then be training the staff members on their roles, so they have an understanding of, where they fit in within the incident command structure. And the last thing I wanted to share was that we're working on continuing our walk-in flu clinics. We're going to be doing them on Thursday afternoons from 2 to 4 p.m. next week starting. People will be able to come and get the standard or high dose vaccine. We're also combining that with booster clinics for COVID. So for people that would like the Moderna vaccine, we're going to be also offering them on Thursday afternoon. So starting next week from 2 to 4 p.m. So those are my general department updates. Does anybody have any questions?
How's the flu vaccine going? Is that we're getting sizable people showing up?
So we're definitely, we had our community clinics earlier in the year. I haven't checked the numbers lately, but we're getting like bits and pieces coming in. We're not seeing as huge of high demand as we've had in the past. Teresa, I don't know if you want to add anything, or Megan.
The only other thing I would add is that now that we're doing the COVID boosters and flu at the same time and advertising it as such, we had a decent number of folks last week coming in for their Moderna booster, and then we offered them the flu shot while they were there, and many of them took us up on the offer. So putting that procedure into place where folks are coming in for their COVID booster shot, but making sure that the flu shot is also available to them. When it's a smaller clinic like that, we're able to do that logistically with a lot more ease. And so we're able to, I think we got about 20 people last week that way. So I'm hoping to continue that as well.
Yeah, I've heard the buzz is that, gee, I got my COVID test, I got my COVID vaccines done, I don't need a flu shot, so.
There is also the people who are resistant to getting the COVID vaccine, and they're not getting their kids' flu vaccines, and they had in the past.
All right, so we'll be offering those throughout the season while we have vaccine and supply. Any other questions? All right, next on the agenda, we have a reaccreditation update. So I'm going to pass it on to Megan to give an update on where we are with the accreditation.
You guys should be seeing my screen and you can hear me fine?
Yeah.
Okay.
Yep.
It's just spinning, so give me a second. But I'm just going to give a quick update on our reaccreditation efforts this past year and this upcoming year. Just give me a minute. There we go. I just wanted to show this map. This is from FAB's website, just showing all the health departments that are accredited or in the process. And you can see in Connecticut, we're still one of 4 health departments that are nationally accredited. And then you can see across the country the rates of accredited health departments. So it's still something very much to be proud of. So, oh, I didn't realize this was all like this. Just to refresh, the mission of the Public Health Accreditation Board is to advance and transform public health practice by championing performance improvement, a strong infrastructure, and innovation. And so that's at the core of FAB. And then by us going through accreditation, that really puts that in our efforts as well as an accredited department. So we were nationally accredited back in 2014 under the director of Deanna as our accreditation coordinator. She did an amazing job. And so for reaccreditation, that goes every 5 years. And so we submitted our documentations back in 2019, right before the pandemic hit. And then we were going to be coming back, hoping to do our pre-site visit review, and that was delayed a little bit. So we didn't complete the pre-site visit review until October. And that's where the accreditation specialist reviews all of our documentations. They may open some measures for additional clarifications, or if they wanted a new example. And so we did that response at that time. And then we did have our virtual site visit this past December 15th. It's like marked in my head now. And it was all a virtual site visit. That virtual site visit is usually, even in the past before COVID, it's always virtual, and it could last up to 4 hours. I felt like ours lasted maybe 2 hours total, even with a break. And so it really wasn't bad. I want to compliment all the staff that were able to attend the site visit. It went really, really well. Then in January, we did receive our site visit report. And this report is what is sent to the accreditation committee when they make their decision if we're reaccredited or not. So they don't see any of our examples, any of our narrative writing, but just that final report that the site visit team prepares for them. And so that accreditation meeting will be in March. So we will be awaiting the final decision. Just a reminder, there are 12 domains. The first 10 domains are the first 10 essential services of public health. I won't read through all of them, But with reaccreditation, there's only 31 measures versus with initial accreditation, there was about 97 measures. So there's a lot less measures, but they still encompass all the domains, and we still have to respond and speak on how we are meeting all of those domains. And so really, so sorry, the joy. So, you know, reaccreditation really builds on initial accreditation, but it's still very different. Again, we both have to meet all the requirements of initial accreditation, but it's really designed to ensure that an accredited health department evolves and improves and advances in the work that they've, you know, done over the past 5 years. So that's really what they are looking at. Let me just go. And so then the site visit report. I emailed you guys all a summary of that report that FAB sent to us and for you guys to review. And so I'm not going to go into great detail, but some of the highlights are that all the measures in all 12 domains were scored met, which is huge. My little man there, which is like huge. That was such a great accomplishment, knowing that all those measures were scored as met. That really speaks to our work. And then just, you know, they have these two areas in the report where it's areas of excellence and then opportunities of improvement. And so that is what is given to the accreditation committee. And these are just some of the highlights that I pulled out. You know, this was in that summary that I sent to you guys, but really the work group that we have for the CHIP, you know, they really highlighted the great collaboratives that we have going on with that, which Teresa leads. Also our social determinants framework that we use, that we're a very data-driven department, that we are ensuring that target populations are engaged in the development of programs and strategies, and that we've advocated to secure sustaining funding for the project coordinator position, which was a big push in initial accreditation, that they mentioned that the project coordinator position should be, you know, a sustainable funding. And then lastly, they noted that our commitment to maintaining committed to accreditation during a worldwide pandemic was, you know, one of our greatest strengths. And so I think that just really speaks to all the work, you know, as you saw the timeline, this was all going on, all this work, while we were also doing contact tracing and planning for vaccination clinics. So I just want to thank the whole team. You know, none of this could have happened without all the staff at the department. That's it for me. Any questions?
No question, just compliments to the staff. I know how much incredible amount of work that is, and congratulations on a good virtual visit.
Thank you, Terry. Thank you, Megan, so much for leading us. And thank you, Aniela, for all your support through this as well, and all the supervisors and the team and the board. True team effort. So thank you, everybody.
Great job.
All right. Next on the agenda is community health update. So Teresa's going to give some updates on what's going on in her division. Thanks, Teresa.
Sure. Good morning, everybody. So Deanna asked me to just give a quick update on some of the activity that's been happening in community health. As you know, and as Deanna mentioned, our staff is growing. The 2 community health workers that we were able to hire under the state's COVID IAP grant are housed in the community health division. So Megan and I are working very closely with them to align, to train them and get them up and running and onboard into the department, but then also to align all their outreach efforts with all the great work that's already been happening in the community, including with our community health workers at our partners at Family and Children's Agency, and then all the work that we've been doing in community health so far. So we're excited to have them on board, and I'm very excited to be building this team to assist with all this great work that we've been doing. Specific to the Healthy for Life project, which if you remember is the community coalition that has been charged with implementing some of our CHIP work, so the Community Health Improvement Plan work. That committee, operated under lots of different smaller coalitions and work groups, especially over the last couple of years. And so late last year and late fall 2021, we were able to bring them back together and really kind of describe to them, these different ways they had been engaged before as community partners. Now, showing them how all of the different priority areas that we had been working on are now really aligned and under the Healthy for Life project. And so some of our partners are really familiar with that coalition name, and others hadn't really been as directly involved under that name. So we brought everybody together, showed them the alignment of all the priority areas for the work that we've been doing, and kind of started to set the path forward, which is really exciting. We hadn't been able to come together as a large group in the last couple of years based on a variety of different competing priorities that everybody's been working on, but the work has always been happening behind the scenes. So to bring that group back together, we met in October really to set the agenda, and then we met again a couple weeks ago to start talking through some of the work plans and the different working groups going on. So we're excited to bring that group back together. If you remember, our priority areas for that group include physical activity and active transportation. So a lot of our pedestrian infrastructure work and walking promotion, nutrition, and food insecurity. So a lot of the work that we've been doing the past couple of years has been around food access and emergency food. And so now we're looking to merge the work of the Food Access Initiative with the Healthy for Life project to make sure that folks who are accessing the emergency food system have access to lots of other resources and healthy, nutritious food as well. This group is also really interested in chronic disease prevention and management, which is an area we're looking to increase in 2022. And then over the past year and a half or so, and as part of the state's Health Enhancement Communities project, which many of you have heard me talk about before, we have started to also look at family supports and home visiting and some of those early childhood supports that can really get that early intervention for both physical and mental health and allow families to really focus on their health and wellness and well-being rather than a lot of the other, ongoing stresses that are happening. So we're looking at trying to really enhance and support the great work that's happening from some of our community partners in that area. So that's the work of the Healthy for Life project from a structural standpoint, but we have some programs and initiatives happening as well. So one of them is our participation in a statewide initiative called the Dash Lap project. And I will always forget the acronym, but in general, it's looking at how to firm up the infrastructure in our state for community health level data. So it includes the Greater Norwalk Coalition, the Healthy for Life project, but then also coalitions in other towns and cities around the state. We're working with a United Way in a different part of the state, as well as Data Haven, which does our community well-being survey for the state every few years, to really look at what data is out there to support work that the Healthy for Life project is doing, right? So in order for us to really understand the needs of the community and also measure our progress over time, we need access to timely data that is disaggregatable at the town and city level, and in lots of different ways so that we can really understand the impact of the work that we're doing and then demonstrate that to funders and to our community and to policymakers to let them know, that intervening on the social determinants of health has an impact on health over time. And so the work of that Dash Lab group is to bring these coalitions around the state together, inventory what data we are using, and then figure out what data we still need, and then kind of bring a wish list or a roadmap to state officials to say, here is where we need more data, here is where we need the data quicker, and hopefully, help us enhance the data infrastructure statewide for this work. In addition to that statewide work, we're also at a local level looking at things like the Know Your Numbers campaign. So if you're familiar with Know Your Numbers, it's really a chronic disease or risk screening program that happens in a community setting. So It could be a health fair, it could be a PTA meeting, but you bring in a team of folks that will assist and screen the community on a variety of different measures like, let's see, we got A1C, waist circumference, body mass index, blood pressure, and then provide folks with real-time information on those measures or their numbers, some counseling and education if there's any areas that they want to improve, and then also connection to care in the community. So we thought it was really important if we're going to be providing these screenings to make sure that that they had connection to either one of our federally qualified health centers, Access Health Connecticut for health insurance coverage, and other community resources out there. And so Kelly, our new health educator, is working closely with our community partners to try to pilot a couple Know Your Numbers events at food pantries in Norwalk and other community-based organizations. So we're working on pulling that all together, and hopefully we'll have something in the next couple of months. But we have several partners who are interested in hosting those events, so we're excited to get those started. And then in terms of other programming and outreach that we've been doing, Kelly and Julia have been working hard with the library on our Healthy Resolutions program, one of our annual programs that looks at some of the common health-related New Year's resolutions that people might make, providing people with information and skills and tangible instruction to help them, meet their goals in the new year. And so I believe that they are 3 weeks in, and then this week is the final week. So the topics this year have been goal setting, sleep hygiene, physical activity, and then this week coming up will be stress and emotional eating. So looking at some of the big New Year's resolutions that folks make, providing them with some general information, and then recipes and access to other resources that they can use to implement their New Year's goals. In addition, we're also doing our Radon Distribution Kit, the Radon Kit distribution. So January is National Radon Action Month. And so the State Health Department each year runs a program where they partner with local health departments to distribute home radon test kits, because radon is an odorless gas that you can't tell is in your house unless you actually test for it. And it's best to test for radon when in the winter months, when you're kind of closed out, the house is closed up and there isn't a lot of circulating air. We're not opening the windows and letting the fresh air in. And so January, February ideal to do those radon tests. And so we had hoped to do an in-person distribution as we have in years past, but we did a quick pivot and change of plans during the Omicron surge. So now residents were asked to fill out a short form to request their radon kit. And we had 100 kits to distribute, and we currently have 100 requests. So we are at capacity, but hoping to see if the state allocates any more tests, we'll reopen that distribution. So residents could fill out an online form, and then we'll mail the kits and instructions out to them, and then follow up with them periodically to make sure that they do their tests. And I'm looking, I think that's about it, in addition to the COVID related work that we have been doing that you guys have already heard a lot about. So that's some of the work that we have going on in community health, and we have lots more planned for 2022, and excited to share more with you as the months go on.
It's a lot of stuff. That's a lot of stuff going on.
They're doing great work. Thank you, Teresa, and to your team, to everybody. Does anybody have any questions? All right. So next we have our COVID-19 updates. I'm going to pass it on to Brian to do an update on where we are with cases.
All right. Hey, everybody. Good morning. So jumping right into it, kind of same structure as before. What you're seeing is the CDC COVID-19 county levels of transmission for the last 7 days. What's interesting here is that essentially the high category, which is the highest it can be, 99.78% of all counties in the United States are in the red, so in the high category. So definitely still demonstrating that even with, current situation right now with COVID, even in the Northeast, definitely the rest of the country is still being impacted as well. And this has actually increased over time. Just the other week, it was at 99.5. So a few more counties, especially in the Midwest and the South, have entered the mix here in terms of that activity. Now, from a more global perspective, we're at 355 million plus global confirmed cases, 5.6 million plus global deaths, 71.7 million plus U.S. confirmed cases, and then about 86.5, 868,514 U.S. deaths. And plus, technically, again, all this information is likely an underestimate of what the true burden is. But again, emphasizing, how serious it is, even though, we're just about, 2 years into this mix with COVID and the pandemic. So what you're looking at right now is on the left-hand side with the purple is the CDC SARS-CoV-2 variant surveillance for the variants of concern. And you can see definitely the purple is Omicron, as we can kind of suspect. So for the most recent evaluation from the simulation models from the CDC, we're at 99.5% of all new cases are Omicron. And then if you look at it from the more regional perspective, again, the Northeast, pretty much majority Omicron, very small slivers Delta. So Delta is still in the mix out there. But it's, it's becoming much rarer in terms of presentation. But you can see how, like in the Midwest, it has a little bit more, prevalence and incidence technically in the Midwest. But again, Omicron, it's the Omicron show is what I'm trying to emphasize here. And even with the state health department surveillance, they have about 95.7% of all specimens that they've sequenced to be Omicron. So again, one of the better metrics and one of the ones that are probably the best to evaluate the situation is the DPH county COVID-associated hospitalizations. This is looking at it for the entirety of the pandemic to yesterday. So you can see, again, just giving some perspective, you look at the left-hand side, 1,972 was the peak relative to the beginning of the pandemic, when obviously we didn't understand that much and didn't have enough resources to really address it, even especially obviously not having the vaccine. But we came very close to this in the beginning of January. We got to 1,939. So only a difference of about 33 COVID-associated hospitalizations. This, as you can see, has been on the downtrend. It's a gradual downtrend, as we'd like to kind of qualify it. So we're currently at 1,477. So we have a decent decrease there. So it's great to see that. And it's currently, a trend that's not only holding here in, Connecticut, because this is, again, just looking at it, Connecticut, but also for a good portion of the Northeast as well. So it's great to see that kind of supported by other jurisdictions as well. But nonetheless, keeping in mind that, Fairfield County is 24% of those COVID-associated hospitalizations, Hartford's 31%, and then New Haven County is 30%. So fortunately, Fairfield County is the lower proportion of those two other counties, but nonetheless, we still have ways to go, is the thing I'm trying to emphasize here. It is a gradual or slow decline. It's not going to be something too immediate. But nonetheless, as you're seeing here in the left-hand side table, in the red is, Norwalk's case rate. So we're at 260.4 based upon the state's current evaluation. This is looking at it from a time period January 2nd to the 15th with a percent positivity of 33.7. The highest is Bridgeport with 318 for their case rate. And then the lowest is actually Stanford at 198.8. So we're kind of in the middle of this. And, relative to this surge, that's kind of where we've been sitting relative to the other big 6 Connecticut cities. Just as a heads up, preliminary analyses do indicate that we'll actually be much lower than our current case rate at 260.4, once the state does its new analysis and release on Thursday. So that's kind of good to see that, again, further supporting that downtrend, but a gradual process. So for the city of Norwalk, so far for the pandemic, we have 20,611 total cases, 247 total deaths. And then looking at from January 9th to the 22nd, that's a calendar week period by age group. You can see how the bell curve that we will typically see for 30 to 39 being kind of the central point and the highest proportion. It's kind of shifted as we kind of anticipate with the younger age groups, especially with them going back to school and everything else. So less than 20 years of age, you can see how, especially the largest portions, less than 10 years of age, essentially 18%, then followed by 15% for 10 to 19. So it is interesting to see that. It obviously, gives us, the reminder that, again, with COVID, once it enters the household, it is going to impact everybody. So whether it's the student bringing it to the household, or, maybe the parents or some other sibling or somebody else residing in the household, it's kind of bouncing back and forth. And so not great to see, but it's something just very much to keep in mind who's being impacted in this. And then let alone as we kind of move to the next slide, keep in mind that, we still have a little bit of a vaccination gap relative to the 5 to 11-year-old age group, just because of their late eligibility in the process compared to everybody else. But you can see we're almost at 38% for initiated vaccination, which is getting at least one dose of the vaccine, 25.4% for fully vaccinated for 5 to 11 years old. But as in comparison to the other age groups, which are maybe in the 80th or 90th percentile for initiated vaccination, compared to 38% essentially for 5 to 11, a little ways to go. So definitely in terms of, opportunities to do outreach and engage that age group. Nonetheless, in terms of all ages, we're at essentially 85% initiated vaccination and 74% essentially for fully vaccinated status. So still great to see that overall, because, when it kind of comes to that terminology of herd immunity, it's, it really does support it. But then as you stratify the data, you can see how there's still opportunity. And this is obviously not something unique to Norwalk. This is for the entire state as well as even the country, just because, again, that late eligibility that came into the process with all these approvals. So that is that. The other thing to keep in mind is national flu surveillance. So as you can see, flu is still going around as well. And, it's definitely very different compared to the prior season in terms of its opportunities to spread and prevalence. So what you can see here in terms of the country, that definitely the South and the Southeast and parts of the Midwest and even California and New Jersey are very much in the high activity. New York and Connecticut kind of meet just like the moderate category, but, we're kind of getting closer, especially with New York, in terms of entering that high activity. So flu is very much still around. If you look at the actual flu data for the state of Connecticut specifically, something like, 1,600 specimens have already been tested. And then there actually has been overall for the flu season 3 flu-associated deaths related to it. So flu's still in the mix, obviously not to the proportion that COVID is, but it's something to emphasize that it's also something else to kind of consider in the midst of all these respiratory illnesses that are going around along with COVID and the variants. So the other thing I kind of stuffed on the right-hand side in the slide here is it's relative to the CDC and NIOSH. And, just emphasizing the fact that when somebody's wearing, a respirator of some sort or face mask, that, technically they should be making sure that it's NIOSH approved and it's not counterfeit, or, it's obviously not a company that's producing things that are substandard and not meeting the manufacturer requirements or the promises that they're marketing. So there was a study done, about 60% of KN95 respirators, during the COVID-19 pandemic in 2020 and 2021, did not meet the requirements that they were intended to meet. So it's something very important to keep in mind. Same also applies to N95s in terms of, there's a large proportion of counterfeit N95s that don't meet the commercial standards that they're supposed to meet. So it's really important that everybody kind of look this up on the CDC or NIOSH website and just verify that, these face masks are meeting the standards that, they want to obviously have the protection for. So just keep in mind that, Deanna found this really great infographic. It's just kind of emphasizing the spectrum of protection. So again, obviously not wearing a face mask, you're not going to get protection relative to, COVID prevention. But then cloth face masks is the next step up. But, it's only providing some protection, and especially in the context of Omicron being one of the most virulent, variants, it definitely doesn't provide that protection that you really need to kind of mitigate, that transmission opportunity. So then really upgrading from even surgical masks, but more so, the high filtration masks, which include your N95, KN95s, and KF94s. And so N95s are obviously the premier standard in comparison. KN95s, KF94s are somewhere in between surgical masks and N95s. But obviously, everybody should be wearing a face mask that they feel comfortable with, they can breathe easily in, relative to the circumstances, but taking into consideration the level of protection they're also getting in the midst of all that. So definitely, if you're wearing a cloth face mask, at bare minimum, mixing a surgical mask into that will help because those layers of protection, especially with surgical masks and, it's vapor barrier and things of that nature. But N95 is obviously the best, and it's meeting commercial standards. It has certain manufacturing standards, and it has that electrostatic property that really helps with that additional filtration for viral particles. So that's really what I would like to emphasize there. And that's why, there's been a lot of opportunities with the various N95 distributions and things of that nature, as well as even the CDC promoting it on in their website and communications as well. So just emphasizing that point. And again, just keep in mind that, the testing for COVID testing in the city is 7 days a week now, and it's at Shady Beach. So there's an infographic there. And then again, you can find a lot of this information I just discussed in the mayor's weekly report that comes out every Friday. You can find it on the city webpage, as well as the social media, such as Twitter, Facebook. All right. Thanks, everybody.
Thank you so much, Brian, for that update. Does anybody have any questions on where we are? Any of the data?
How are you doing on distribution of kits?
So we had those two large community distributions that, were led by emergency management, and the health department supported that. So and thank you for asking this question, Ken, because our volunteers and our emergency preparedness staff braved the cold, really cold temperatures to get that out to community members, did incredible work. So there were two large ones, and they went well. It moved quickly. The second distribution, there was the registration system worked out really well too. People were able to register, and then it made the process even more smooth. So that went really well. There also was some distribution to some of our community providers that serve Norwalk residents to help get the kits out, in particular to seniors. So that's gone well. Now we're promoting and letting people know about the option to sign up online through the federal government to get test kits mailed. You can get 4 tests mailed. So right now, that's what we're focusing on, promoting that. But right now, we don't have any. We don't have any kits in hand right now anymore. There's no more large public distributions right now, as of now. But over the past month, cities had to move pretty quickly too to get all those plans in place too. Teresa, did you want to add anything?
Yeah, I just wanted to let folks know that we did add a page to the website that has guidance for the at-home tests and how to use them and how to interpret the results. And then there is a link to an online form if folks do test positive on an at-home kit. They can report those results to the health department and then get an automated email with some guidance. So we're trying to, we know that we're not going to hear about all those at-home test results and that people are using them in different ways, and just wanted to make sure that people have some guidance on the best time to use the at-home kits. And then, if they do get a positive result on an at-home kit, what does that mean and what should they do next? So we've put that information up on the website.
Yes, I'm afraid our statistics are going to go south on us because when you figure the denominator of people being tested, how many negatives are out there? Nobody's reporting any of that stuff anymore. So all of our percentages and all the rest, I don't know how they become valid anymore after we have millions of tests circulating the marketplace. So guess it's going to be done based on symptoms and hospitalizations are the only ones that you're going to factually know real quick. And the next move is masks, right? So masks are going to be the next distribution process from the Fed. I know that there's a few pilot programs. I know Optimus, Dr. Weinberger's place, is one of the pilot. There's 3 pilots going on in the state on how to distribute the pallets of masks that'll be coming forward. Community health centers are going to be one of the entry points. And I didn't know if the health departments were also going to be part of that.
We're not part of that specific distribution. We did assist the city when they gave the at-home test kits, whatever masks that we also included a distribution of masks as well. But I think we're not part of that partnership with the federal government. I think it's pharmacies too, right? It's the community centers and pharmacies.
Right. Yep.
I just wanted to compliment Sorry, go ahead, Pen.
I was just gonna say some of the difficulty with all that is now we're adding more burden to all those areas. Somebody's got to be trained on how to use it and on a mask appropriately. So you're taking a little bit of time out of everybody's day. You know, it's great to have the stuff, but it's the workforce hit is still happening. So we'll see how it goes.
I just wanted to compliment the staff on the distribution of the COVID kits. Both my daughter and I went down separately to pick up on I think it was the last day with the appointments. It was a very well run, and you could see that everybody that was working there was freezing, and it went very quickly. And I just want to compliment everybody that was there. I wanted to jump out and give everybody hot chocolate.
Thank you, Terry. Yeah, that was a great partnership across the city, emergency management, police, fire, all the mayor's office, the IT department for helping with the registration, and of course, all our staff and volunteers that assisted. So thank you. So Ken just reminded me when he was making those comments, it's the demands on the staff and the volunteers. It's just continued throughout this whole pandemic, right? And it shifts to at different times. It's different things. It's vaccines. It's masks. It continues for sure. So I just want to use this opportunity to thank our incredible staff and volunteers for all that they've been doing throughout this entire pandemic.
Can I just give a shout out to our front desk staff who, we're talking about these mass distributions and that the federal government is shipping them to this particular partner or that particular partner distributing. It reminds me that every time a news story comes out or something, comes out, whether the information captured is accurate or not, or vague, or it changes, our front desk staff is on the front lines, answering the phones, trying to figure out the best information to give people, where to direct information, and it's constantly changing. So that is one of the big challenges is determining, who gets which inquiries, because sometimes one department's handling it, sometimes others are handling it, and they do an amazing job of keeping track of everything, staying patient with me and the situation. And really doing the best they can to help people find the information that they're looking for. So they are really, they do an amazing job. So I just wanted to thank them as well.
Thank you, Teresa. They do, and it's great that people know that we're a resource. But our front desk staff, they work incredibly hard to get the answers that people need. And thank you, Teresa, to your staff for helping support that too. All right. Well, it's 8:46. I don't know if anybody has anything else to bring up before there's public participation, but I don't see any attendees. Am I inducing? I don't see anybody. Okay. All right. Anything else before we adjourn this morning? All right. Well, then it's 8:47 and we can adjourn.
Thanks for all you guys do. Great job.
Bye, everyone.
Bye, thank you all. Keep up the great work.